Hey guys, Dr. Jen. I have a little bit of time before my next patient, so I thought I would hop on and do a brief introduction to DBT, Dialectical Behavior Therapy, which I believe is the cardinal treatment for BPD, Borderline Personality Disorder. I understand not everyone responds to it. At the same time, I think it's a great therapy to use for anyone and everyone, because it really just teaches us how to control our vulnerabilities and manage emotions as we go through life and as we respond to things. So DBT, Dialectical Behavior Therapy, was created by Marsha Linehan, and she is a psychologist who was actually institutionalized for over 2 years initially for suicidal ideation. And long story short, she didn't love the methods that were being used. So she basically wrote her own model, and it has saved countless lives. The long and short of it is this. DBT is based on a continuum of acceptance versus change. So there are certain things that happen in our lives that we are best off to accept because we can't change them. It doesn't mean you condone it. It doesn't mean you agree with it. It doesn't mean you like it. But you accept it because that's the only way that you can come to terms with the reality and then handle that. So she talks about like a flat tire. If you don't acknowledge that your tire is flat, if you don't face that reality, then you can't fix it. So acceptance is one end, and then change is the other end of the continuum. So change speaks to, okay, now we recognize this problem in our realm, in our environment, in our life. What are we going to do about it? And what she did is she designed 4 modules, 2 for each one. So there are acceptance skills that are taught, and there are change skills that are taught. So the acceptance skills, just coming to terms with a reality in your life that you can't necessarily change or impact, those are mindfulness and distress tolerance. And then the other 2 for change, when you need to effect a change in your life or on something, a situation, those are interpersonal effectiveness and emotion regulation. So the idea with these skills is to teach us how to deal with situations that occur in life. And this is why I think it's great for everyone, because we all get emotional or sensitive to certain things, or we have a reaction, sometimes big reactions. Even if you don't fit the pattern of BPD symptomology, you may still have reactivity in your life that you could do better at managing. So again, we're talking about DBT, Dialectical Behavior Therapy. You can Google it. You can go under the resources tab on my website and find countless resources on this. But the idea is acceptance versus change. We want to learn skills for accepting the things we can't change, and then we want to learn change skills for changing the things we can. Now, the very first thing that she teaches is mindfulness. And that is basically awareness. So she learned these principles from Zen masters, basically. And she incorporated those. DBT is the first therapy that actually incorporates mindfulness as a specific skill. Now, you don't have to be a Zen master to master mindfulness. A lot of people, when they think of mindfulness, they think of, meditation, and you have to be really good at that and reach the different, levels of meditation, and that's the only way you're going to calm yourself down. It's really not like that. If you can do meditation, great. If you can do relaxation, deep breathing, yoga, some things that help you to settle your nervous system, great. But mindfulness as a basic concept in DBT just really means awareness. So I become mindful of my surroundings. I become mindful of how I can impact my environment and how I can't. And it's really just another word, I think, for it is awareness. So it's really just becoming aware of your vulnerabilities, the things that set you up for failure in some way. And then it's also becoming aware of what you can and can't change. Being aware of the impact on other people, being aware of people's impact on you. So just becoming aware of your surroundings. Within mindfulness, there are how and what skills that DBT teaches. And I'm not going to go into that. I'm just doing kind of an intro today. We're going to do a lot more of this in my psychoeducation community, which right now is free. So if you click on the link at the top of the page here, you'll see an opportunity to join that free community. And then if you like what's going on in there, then you can join a subscription service that's going to come later. So someone's asking, how do you heal from triggers, or how do you stop them? That is a really great question. That's a huge issue for people with BPD, right? So the first step is mindfulness. This is why Linehan teaches mindfulness as the very first thing, because it's so important to get grounded and then respond. And you have to be mindful in order to implement the other skills. So the way that you do that is with mindfulness. So the idea is that I'm going to learn to become acutely aware of my vulnerabilities, the things that are going on in my life and around me and inside my body that will trigger me to respond to a certain stimulus in a certain way, or to a lot of stimuli in various different ways. So it's really just learning to ground yourself, become aware, and then implement these particular skills. So mindfulness is first, and not necessarily going in order, but that's the first acceptance skill. And then distress tolerance is the second acceptance skill. So what that means is I see something that's going on. I can't change it. I really don't like that. I'm having a reaction to it, but I don't want to react in a big way. I don't want to be hypersensitive to it. I don't want to damage the relationships with other people. So I need to figure out how to tolerate that distress. And there are lots of different contingency management skills and things like that. Again, the idea is to prevent vulnerabilities, to decrease or to increase your awareness, and then that helps you not respond to triggers. So mindfulness and distress tolerance, and then the change skills are interpersonal effectiveness and emotion regulation. So those of you who are sending me questions, thank you for participating. If I don't get to your question because I want to finish this content, please go and shoot me a separate message, and then I can answer it in a video that way, or respond to you depending on, how long the answer is. But if I don't get to you, I'm not ignoring you. I'm just trying to get through this content before I have to get to my patient. So be sure you message me with what your specific question was. Okay. So mindfulness, distress tolerance are the acceptance skills. Interpersonal effectiveness and emotion regulation are the change skills. So what does that mean? Well, interpersonal effectiveness has to do with looking at being effective in maintaining interpersonal relationships. So simply relationships between you and other people. Interpersonal, between persons. So the idea here is learning how to navigate your reactivity, your emotionality, so that you can leave an interpersonal interaction feeling the way you want to feel about yourself at the end. And there's some importance to how other people feel about you as well. It depends on the person, right? So, but you want to walk away from this situation knowing that you did the best that you could, that you mitigated your reactivity as best you could. And you want to preserve certain interpersonal relationships. So the interpersonal effectiveness skills teach you how to do that. The second change skill is emotion regulation. So this is a big one. And again, mindfulness is at the core of all of these. So all of the other skills build off of mindfulness. That's why she teaches it first. So emotion regulation is learning how to mitigate vulnerabilities. Again, be aware of the things that make you vulnerable. Environmental factors, personal factors, you name it. There are 4 different categories that I talk with people about in terms of vulnerabilities. So you learn how to regulate those. And then, because you have those under control, you learn also skills for how to interpret information in a less damaging way. That has to do with vulnerabilities technically as well. But your perception is your reality. And so you guys have heard me say before, yes, BPD is a personality disorder, but it's also an information processing disorder. Now, that's not a category of diagnosis in the DSM, but it is an information processing disorder. Information comes in, it's received and processed in a certain way that results in triggers and then responding appropriately or accordingly, I should say. So learning how to regulate those emotions so that you can respond in ways that are conducive to your goals. So DBT is what we're talking about, Alyssa, thank you. Dialectical behavior therapy. And it's the cardinal treatment, in my opinion, for BPD, borderline personality disorder. Not to be confused with bipolar disorder, which is not a personality disorder, but a mood disorder. And I've got videos on that pinned to the top of my page. There's one that talks about the difference between the two disorders if you want that. So dialectical behavior therapy, Alyssa, means it's the primary dialectic. So a dialectic is a discourse of two people with different opinions. So if you look at it as a continuum, they're at opposite ends of the continuum. So the idea is that we learn about dialectics within us, and then we learn how to modify our behavior. We learn how to change those with perception and altering your perception and triggers and being mindful of vulnerabilities. And then we learn how to change our response set, change our behavior. So you become aware of these dialectics within you. So some of the dialectics are like, I really need help. I'm helpless. I can't do anything on my own, versus I don't need help. I've got it under control. Everything is fine. I can take care of this myself. So that's just one example of a dialectic. There's a lot more on that. And again, today's just an intro video to the 4 components. We're going to be doing a lot more on emotion regulation, mindfulness, distress tolerance, interpersonal effectiveness in my free for now community. So if you click the link at the top of my profile, you can join the free psychoeducation community group. I'm going to start in there with things about perception and boundaries and stuff like that. And we're going to move into emotion regulation skills and skills that are helpful for everyone. We're also going to talk about some relationship stuff because, of course, I wrote a relationship book. Again, I see a lot of you putting questions in, and I'm so glad you guys are participating. I love seeing all of the hearts and all the different things that you guys are doing. If I don't get to your question, it's because I'm focused on specific content right now before I have to get to a patient. So please message me privately with your question, and I'll either answer you in a message or I'll do a video and we can share that information with other people. If you have a question, chances are somebody else does too. There are nearly 8 billion people on this planet, so you aren't the only one who thinks, believes, feels a certain way. So please share your question. If you don't want me to mention you in the video, just indicate that, that's fine. Generally, when I do videos taken from messages that I receive, I'm not referring to the author of that message. So, but make sure you send me a message so that I can answer those questions. So, Alyssa, hopefully that explains DBT a little bit more. Again, the overall idea is that with BPD, what we're looking at is an information processing disorder. And that means that information comes in, perception is reality. So how I perceive that information triggers something within me, if I have BPD, such that I respond in a very triggered and vulnerable way. So DBT is about learning to be aware of what your triggers are, learning to regulate that emotional vulnerability. And we have a continuum of acceptance versus change. In life in general, we operate on that continuum. There are certain things that we can accept, certain things that we can change, and then there's stuff in between. So most of life isn't that black and white, but a lot of people, most people, if not all people with BPD, the biggest dilemma that I see for them is black and white thinking. So if we can get you to look at this continuum and kind of come more into the middle, but still know how to handle those ends, at least in the beginning when you're learning the skills, then you're going to be more responsive in your environment and in your life in ways that keep relationships that you want. So again, acceptance versus change is the primary dialectic. Marsha, I mentioned this earlier, Marsha Linehan created this method after being institutionalized for a couple of years and not really getting what she needed, not feeling like the providers at the hospital really understood what she had going on. So she wrote her own method, she wrote her own model, and I think it's the best thing going. There are lots of people who say they don't respond to it or haven't responded to it or they don't like it for this or that reason. And I would argue that maybe it hasn't been presented to you well then, because I do believe that the skills of DBT are good for everyone. In fact, everyone who comes through my office, whether they have BPD or not, most of my people have BPD because that is my specialty, but whoever comes through my office is going to get some DBT skills training simply because I believe her model is so effective for helping us learn to regulate our emotionality and pay attention to what's going on within us. So I've done some other videos about perception and how that can affect us. You can go and take a look at those. But basically, a trigger, someone asked about triggers earlier. So triggers are things that happen around you or in your environment that make you respond in a certain way. Now, because the trigger is activated, your response comes, automatically out of that, it feels like. But there is that nanosecond of time where we can teach you how to, first of all, change your perception. The biggest issue with BPD, I believe, is the black and white thinking. And one of those things is personalization, which means that things are taken way too personally. So once we learn how to modify your perception and we learn to insert that pause, this is where mindfulness comes in. We teach you how to insert that pause so that you can think about what you're doing and then respond. Okay. So again, if you guys are asking questions and I don't get to you, I'm not ignoring you, but I'm teaching specific content today. So make sure you message me with your questions. Alyssa, I see you. I agree. I mean, I feel like black and white thinking is so easy, right? Most of our thoughts, BPD or not, most of our thoughts as humans are negative and repetitive. Why, I don't know, but it's about a 5-to-1 ratio. So for every negative thing that happens, we need about 5 positives to undo that or start to undo that in our brains. So Claire, you can learn how to insert the pause. Join my free psychoeducation community. We're going to start doing some skills training in there after we look at perception and how to set boundaries and some of those things. We're going to be doing emotion regulation. The group is free for now. Just click the link at the top of my profile, and I'm going to be providing information in there. And then if you guys like what you see, you can join with the subscription service, which is only going to be $29 a month for the beginning. That's less than $1 a day for some mental health coaching. It's not therapy. I do need to be clear about that. It's not the kind of arrangement where I can do individual therapy or even group therapy. This is going to be mental health coaching and skills training specifically. So we're going to be talking about perception, boundaries, relationships, DBT skills, simply because I think those are useful for everyone. And I think that it's just helpful. Once you learn how to regulate your perception and then your emotion, it's life-changing. If you can change your thoughts, you can change your life. So I have training built around this as well, for as low as $7, learning how to change your negative automatic thoughts. The idea is that the way it works in the brain is thought, feeling, behavior. Now, thoughts we're not necessarily in control of, right? You guys have seen me do the, whatever you do right now, don't think about a pink elephant. Okay, well, to hear that, it's going to pop into your mind. And so you can't control that thought coming in there, okay? But you can determine how long it stays and what you do with it. It's like an unwanted guest, right? You can't control when they just pop by your house, but you can damn sure control when they leave because you can ask them to leave. So we want to learn how to regulate the thinking, changing perception. What do we do with those thoughts before we let them become behaviors? So it's inserting that pause of mindfulness, learning, using interpersonal effectiveness, distress tolerance, emotion regulation, different skills, and then deciding how we're going to feel about it, because you do have power over that, and then deciding how we're going to behave. And a choice not to act is still a choice. So sometimes we do need to act. So if it's something on that acceptance versus change continuum that we can change, then we need to decide how to act. If it's something that we can't change, then we have to learn to accept it. And again, for those of you who are just joining us, accepting doesn't mean you condone it. It doesn't mean you're like, it's okay, no big deal. No, there are horrible things that happen to people in this life, right? And so it's not saying that's okay. It's accepting the reality of the situation, and it is what it is. That's one of the phrases that is popular in DBT. So I'm going to be teaching DBT skills in my community eventually. If you guys want to join that, click the link at the top. If you want individual sessions, DBT, I do those. I have a virtual practice, and I can practice in most states of the United States. There are a couple handfuls of holdouts. For whatever reason, I don't know. But you can message me with how old you are and what state you live in. And then we can see if we can set something up if you want to do individual sessions. I do have some openings in my schedule right now. I don't take insurance, so I got out of insurance. You guys have heard the story, some of you. I got out of insurance earlier this year because it was an absolute nightmare. So I do individual therapy, but it's for cash only. If you don't live in the country, then what you can do is look into your state, province, country's rules for a psychologist from another country practicing in your country. And then I need a copy of those regulations. I need to have that link to go access that information. So you can find out what that is. You'll have to do some research on your end. You're looking for like a board of psychology, a board of behavioral health, behavioral science maybe. In Arizona here where I am, it's called a board of psychologist examiners. So you can search that up and see what kind of rules there are in your country, your state, your province, however it's regulated where you live, and then give me that information. But you can start by, if you're in the United States, you can start by sending me, and you want to do individual therapy. I am accepting new clients. You can start by sending me your age and what state you live in a message here. So, all right, so we were on today talking about the 4 modules of DBT, 2 acceptance models, 2 change model, 2 acceptance modules, and 2 change modules. It is a wonderful therapy. Again, for those of you who haven't heard of it, dialectical behavior therapy, it helps you to learn how to regulate your emotions. It helps you learn how to shift your perspective and become more mindful of what's going on around and within you so that you can respond in ways that are conducive to the life that you want. If you're struggling with negative automatic thoughts, I do have training on that for $7 right now. You can click the link in the top of my profile and scroll down and see all the training. There's free training, there's paid training, there are several options. So again, Claire, I see you asking about the different modules. So mindfulness and distress tolerance are for accepting the reality, and interpersonal effectiveness and emotional regulation, or emotion regulation, Linehan calls it, are for change. So it's 2 different modules for 2 pieces, and it's a continuum, a primary dialectic of acceptance versus change. And again, a dialectic is just a discourse between 2 people with different opinions. So the idea is that you could be, you're welcome, but you could be on the acceptance end or you could be on the change end, and it just depends on the circumstances. It's learning how to regulate your perception, mitigate your vulnerabilities, and then respond in those ways that are conducive to what it is you're after in your life. So I've got to wrap up, guys, because I have a patient here at 4 o'clock. So if you are interested in the free community, you can click on the link at the top of my profile and join that community. It is free for now, just disseminating information and putting stuff out there for people. Eventually, it will start off at $29 a month for those who are interested. You do not have to join. When you join for free, I don't take your credit card information. It's nothing like that. I'm not going to try to force you to be in something you don't want to be involved in. If you like the material and you like what we're doing in the group and you want to do the subscription, I'm offering that for less than $1 a day. I know everyone can't afford individual therapy, so I'm trying to do this as a way to put skills out there. It's not therapy, but it's going to be mental health coaching and skills training. So just click the link at the top and then you'll see join the free psychoeducation community. You can join that. When it goes to subscription, you can decide if you want to play or not. Okay. If you want $7 training on disputing negative thoughts, and I'll teach you how to dispute any negative thought that comes into your head with my method, Click the link at the top, go to the Psychoeducation Academy page, scroll down, you'll see all of the free and paid training that I offer. So that's the gist of it for the basic DBT skills modules. And we're going to do more on this in the future, especially in my community. So make sure you join me over there. Take a look. It's free right now. Take a look, see if it's for you. If it's not, no hard feelings. It's not for everyone. So I respect that. But come hang out at least while it's free and see what kind of information you can get and what things you can learn. All right, guys, that is all for today. I've got to head out. So I will see you guys next time.